Michele Vasquez, and I'm going to be giving speech number 2, which is my demonstrative speech. And this is my audience.
Hi, I'm Kelly, Michelle's friend from elementary school, here to listen to speech number 2.
Hi, my name is Edgar. I'm listening to speech number 2, and I'm her son-in-law.
Hi, I'm Mike. I was here last week, and I'm her husband and her lover.
Hi, I'm Billy, and I was here in the last presentation.
And I'm Victoria Moore.
All right, today I'm going to be speaking to you about diabetes and the importance of making sure that you are actually treated for diabetes. Behind I have my presentational device. I don't know if it's going to show up as good as I wanted it to. I apologize for that. And my statistics were all gotten from the website for the American Diabetes Association. This is the most current that they did have listed. The importance of diabetes is, again, diabetes is a problem with your body that causes your blood glucose levels to rise, or in some cases actually go lower for hypoglycemia. There's 2 types of diabetes. You have type 1 and type 2. With type 1, the body breaks down the sugars and starches into a simple sugar called glucose. With type 2, the body doesn't make enough insulin, so then the body's trying to make up for it. So let's get to our statistics. In prevalence in 2012, 29.1 million Americans, or 9.3% of the population, had diabetes. Approximately 1.25 million American children and adults were diagnosed having type 1 diabetes. Undiagnosed was 29.1 million people that, again, 21 million were diagnosed, 8.1 million were undiagnosed. That means they didn't even know they had the disease. Seniors are affected at a little bit higher rate. The percentage of Americans age 65 and older remains high, and that's 25.9%, or 11.8 million seniors. And that's diagnosed and undiagnosed. There's 1.4 million cases every year of diabetes. And in 2012, there was 86 million pre-diabetes cases in people aged 20 and older. This is up from 79 million, and that was back in 2010. Then, unfortunately, we go to the deaths related to diabetes. Diabetes remains the 7th leading cause of death in the United States in 2010, with 69,071 deaths. 234 deaths listing diabetes as the underlying or contributing cause of death. So then, with that in mind, we want to make sure you know the signs that you're supposed to look for. Weight loss, extreme tiredness, blurred vision, going to the bathroom more often than normal, and then increased thirst. Testing for diabetes is painless, and it only takes a few seconds. This is one of my glucose monitoring devices. You have a test strip, which actually you take out, and you would obviously wash your hands prior to this. You put your test strip in the end of your machine, like so. You would then take your lancing device, which has a needle in here, and that, again, you would change those after every use. You don't have to, but I do. You would then pull this lever back, and then that does give a spring effect to the lancet when you poke it, and then that needle comes out. You again would do it on the side of your finger, not on the bed of your finger, and then again push this. You're going to get a prick on your finger. It's going to give you a blood droplet, and then again you would just apply the droplet to the testing strip. It sucks it up kind of like a straw, and then your monitor gives you a readout, and that would be how you would check your sugar. Again, dispose of the needle always in a sharps container or a plastic container with a lid on it so nobody does get poked. The American Diabetes Association recommends for most adults before meals 80 to 130 is a normal reading. 1 to 2 hours after you eat, it should be less than 80. If it's any higher than that, you definitely want to make sure your doctor's aware of it. Going back to complications that can arise from this, you can develop hypoglycemia, which is a low blood sugar, hypertension, and dyslipidemia. And with that also, that's affecting your cholesterol. The population with cardiovascular disease was up in 2000-2006 Deaths were about 1.7 times higher in adults age 18 and older, and heart attacks as well. You want to make sure you keep an eye because this does affect a lot of different things. And then amputations. A lot of people that have diabetes have major foot problems, and it does affect. Amputations was about 73,000 in the lower limbs, affecting either the legs or the feet. And that is a major problem for diabetics, is their feet. So we definitely want to watch for that. And then you've got blindness, eye problems, and kidney disease that all can develop from this. So definitely make sure that you are checked for diabetes and on a regular basis. Again, you want to eat a healthy lifestyle, get exercise, and make sure you're doing what you're supposed to. Don't fall prey to this. Make sure you know the symptoms, you know the signs, the complications, and how to be tested. And I do want to thank you all for coming today. With that being said, how many of all of you are going to be tested now?
I'm good.
All right, thank you guys very much, and that is the end of my demonstration.